Tracy, doesn't the U.S. have like the best healthcare system in the world?
Wrong. Actually, we're last, like Bernie was saying, of all industrialized nations, we're last. So it's Australia, Canada, France, all these places that have socialized medicine actually are way ahead of us. So that's kind of startling, right? Because we've been told our whole life we have the best of everything. So yeah, these are our overall rankings, like care process, access, administrative efficiency, equity, and healthcare outcomes. And Lauren, could you make your point?
Yeah, so interestingly, okay, access, 11, we're like way down there. Administrative efficiency, 10, pretty far down. Equity, 11. Healthcare outcomes, 11. So our healthcare outcomes are poor. Yet our care process we rate as a 5. So this is kind of what we're saying here. We are healthcare providers. We're occupational therapists. We worked in the hospital. The care process is good. We're not saying doctors suck, nurses suck, everyone sucks. We're not saying that. There are people who do a really good job and do what they were taught to do. The problem is what they were taught to do is not leading to good healthcare outcomes. So they may have a great care process. We may be doing a really good job providing the care that we know how to provide, but we have blinders on. We're like horses with the blinders on. We need to open our eyes to all these different approaches in healthcare if we really want to improve our healthcare outcomes. And other countries are doing that. There are countries that literally head right for Eastern medicine, left for Western medicine. They have both. And we're just like, no, drugs, 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 drugs. And as I said, 150 years of pain medicine really had detrimental effects. So what are these other medications doing to us? That'll be another presentation.
And we're never really educating our patients about why they're in the hospital in the first place. And I hear a lot of people in the ER, when I was there recently for a family member, the guy was asking the doctor, hey, like, why am I here? And the doctor's like, I don't know. He's like, so I'm spending all this money, my insurance is spending, and you don't even know how I got here or why? And he's like, no, couldn't give him an answer. So I would try to research with my patients why they were in the hospital and educate them on it.
Tracy used to say it worked till like 11 p.m.
Yeah. So I didn't have a life, but to me it was worth. Okay, so I think that we're in a healthcare crisis in the United States, and you will too after this slide. So 99,000 deaths per year were from hospital-acquired infections. That's including bladder infections, surgical site infections, pneumonia, and bloodstream infections acquired while a patient was in the hospital seeking treatment for something else. 1 in 25 hospitalized patients will be diagnosed with at least one infection caused solely by hospitalization. And actually, it's the third leading cause of U.S. deaths are hospital errors, 250,000 deaths per year. And that was by Johns Hopkins Medicine in 2016. And Dr. Pangattoni did a review of 337,000 studies that looked at medical errors and found that about 5% were preventable, and 49% of preventable injuries were due to drug-related problems. So probably like an overprescription or a drug interaction or a misgiving of that drug, and that led to injury. Also, hospital-acquired infections accounted for 16% of injuries in that review. So life expectancy, that's a good projection a lot of times of how we're doing in health. And in the 1900s, we were at about 47 years. And in 2014, because of like public health measures, hand washing, we moved all the way up to 78.9 years. But in 2018, it was the first time where we started to go backwards, where the generation born after the previous was going to live not as long. And that's striking. And we're also behind other countries, industrialized nations, for life expectancy. So I'm just saying why. I'm just wondering, why is this happening? So we started to look at the causes of death between the 1900s and in 2017, the last I was able to find. And you would think in the 1900s to 2017, there would be a big difference, right? We're making all these medical innovations. We're so smart. We're so scientific that there would be a totally different list. But in red here, heart disease, cancer, accidents, stroke, Alzheimer's disease, influenza, pneumonia. Sorry, I got to talk into the microphone. These were all the causes of death in the 1900s as well. We haven't made any improvements in it. So all these things as well are actually preventable. We know, stress is a leading cause of a lot of these things, diet, and we're still having this as a leading cause of death. And even more shockingly, could you hit me up?
Sorry, one more thing. The only ones that did improve, things like tuberculosis, diphtheria, things like that, those were things that antibiotics came out and fixed those things. So we developed a chemical that did cure those things. But now, with all these chemicals we're developing, why can't we cure all of these other things? Can chemicals cure us? Or are we electrical beings that cannot be cured with chemicals? And in 2 weeks, we'll explain that a little bit more in one of our presentations.
The number 12 leading cause of death is suicide. When I looked at this broke my heart. Like, the number 12 leading cause of death is someone killing themselves. And I feel like we need to that's a mental health crisis. We need to do something about that. And I don't think that we are. I think the state of mental health in this country is very poor. I think we could do a lot more about it. And I think that that's really terrifying that it's number 12.
And I'd be interested to see how many of those people have chronic pain or some kind of chronic illness that's resulting in poor mental health.